Hello and welcome to Healthy Living. My name is Dr. Donald Pelto and I have Dr. Pamela Kim here. And today we're going to talk a little bit about vascular disease and different problems with the blood vessels. Welcome, Pam.
Hi, thank you for having me.
You're welcome. You're welcome. So today we're going to talk about with everyone about kind of what you do in terms of vascular. You're trained in vascular surgery and vascular procedures. And so tell me a little bit about kind of what you do, how you got interested in this area of medicine.
Yeah, so I initially was trained in general surgery, and then I got interested in vascular surgery in particular because I found it fascinating that basically we're made up of these complex system of pipes and they deliver blood to and from all different areas to our bodies, including the organs. And you can actually go into them and open them up, stent them open, clean them out, close them, patch them up, and even reroute them and to help improve the patient's blood flow. And then, so I was a vascular surgeon, and then I decided to focus mainly on veins in particular, and veins of the legs, because so many people have problems with the veins in their legs. Actually, 1 in 4 Americans do. But this is something like venous disease is something that's not really well known or really well understood by so many people. And it's not just your average person either. It's not much discussed in medical school. And even during vascular surgery training, you don't really go that in depth into it. So this is something that affects so many people and creates a real lifestyle impairment for many, and the potential to be able to help these individuals is very rewarding, which is why this is such a great opportunity to be able to focus mainly on veins.
Now, in terms of the vein, did you have a lot more to learn after, because you finished vascular training, so you had to go back and learn more about veins? And are there different procedures or different techniques that you're using now that you didn't use as a regular vascular surgeon?
Well, I actually did an additional fellowship training in venous disease. So I am super specialized, actually, to be able to address these venous issues. A lot of technology has come along, especially within the past 5 to 7 years. But the great thing about it is that everything can be done in the office, and it's very straightforward.
Yeah, that's great. I know, because I just, for those that are listening, if you have friends that are surgeons, it's a time suck at the hospital. It just kind of, you never know how your day is going to go. You always get behind and everything. And so the more we can do in the office, and there's a big trend going towards back in the office type of procedures. So tell me, like, what are the top 3 things that you see that kind of give you joy that you like doing?
So, a lot of people think that vein disease is like little spider veins or large ropey varicose veins, but it's
that's what I think. Just
it's so much more than that. Most people have achy, heavy, tired legs, or even a little bit of leg swelling. And this is something that a lot of people say, oh, it's because I'm getting older. Yes, a lot of things can cause these things, but again, so many people have problems with the veins in their legs, and actually over 50% of the women over the age of 50, probably their achy, heavy legs are due to vein problems, not necessarily simply getting older. So having somebody come in who has suffered from something like this for years, and then being able to treat them, and people come back and say, I can go up a flight of stairs again without a problem. I go running for 5 miles when previously I had trouble, barely going around the block. That is amazing. We've also seen people with these wounds and sores, which, at the advanced stages of vein disease, you can see. And this sometimes isn't recognized that it's a problem with the veins. And so they have this thing on their leg for 7-10 years. They can't go to the beach, they can't wear shorts, anything like that. And then we treat them for 3 weeks, and their life has changed. We have people who come in with this, and they tell us that they're going to spend the entire summer on the beach because they haven't been able to do that for the past 10 years of their lives. So those are the stories that are the most rewarding.
Those are just some great, I think people it's one of those things, there's certain conditions that no one really knows about, Dr. Kim. And, you know, everyone, they might Google like varicose veins, or they might Google tired legs, and they're going to get a ton of different results, like from anything from like tendinitis or muscle soreness or whatever. How do people know when they should see like a vascular surgeon or someone like you in a vein center? Are there certain like things, like I think of like claudication is something that we talk to them about, like if they have cramping when they walk after a block, or they have a sore that won't heal, you should probably go see a vascular surgeon. Are there other things in terms of vein disease that would trigger in their head, like people that are listening to us?
Yeah, so things specifically for vein disease are going to be aching, heavy, tired legs, especially after standing or sitting for long periods of time. You know, you have the stories of like the mother of three who at the end of the day, their legs feel tired and they think it's just because of running around with the kids all day. But vein disease is probably a big underlying factor. Sometimes people can have spider veins, you know, those small lacy red things, and people think it's just cosmetic, but that may just be the tip of the iceberg. You may have something going on underneath, especially if you have those symptoms where your legs feel heavy. And then on the other end of the spectrum are going to be people whose legs are a little bit swollen. You know, we all get that little bit of like sock indentation at the end of the day, but if it's a little bit, if you have that plus, you know, a little bit of spider veins, it might be something that you might need to look into. If you have skin changes, sometimes you can get darkening of the skin, especially just around the ankle area, or even a little bit of a pebbling appearance of the skin. That signifies that you actually have an advanced stage of vein disease. And then of course the wounds. Yes, people with arterial issues have wounds, but the venous wounds are mostly around the ankles, just in the medial aspect of it.
The inside of the ankle.
Yeah.
So this is a great question. Everyone asks me, and I know how I explain it, but how come, doctor, do I get like the gold color around my ankle? We know what they're called, the hemosiderin deposits. But how do you explain that to patients? I'm sure you get that question. And would doing some work, does that ever resolve, or is that just something, but you just do your treatments for?
So you generally get it because, you know, when you have problems with the veins, I guess commonly people say you have leaky valves, you know, so the blood isn't going up back towards your heart efficiently, and the blood kind of like tries to backtrack down into your foot. So as the blood kind of stays there, part of it comes out, and as it leaches out and it goes to your skin, that can cause that bruising effect, because that's what it effectively is. It's a long-term bruise. And when it goes onto your skin, then that can change the color of it. And unfortunately, this is, when it gets to this stage, it's permanent. When we do treat it, sometimes it gets a little better, but I don't promise my patients anything.
Yep. Well, that's a great answer, the bruising. And then let's say someone comes and sees about vein issues. The first thing I recommend usually is like compression socks. Do you do exams first? Do you do compression socks first? Kind of what's the protocol that you typically take with patients when they come in?
So when somebody comes in and they're concerned about it, you know, of course we talk to them, and especially if it sounds like they have a problem, what we can do is do an ultrasound. The ultrasound is the way that we can diagnose problems with the veins. And that's what we look specifically for, those leaky valves. We look at the deep veins. These are those major highways that bring all the blood up, the ones people get concerned about having blood clots in, DVTs and the like. But then we also look at the veins closer to the surface, and these are the ones we can manipulate. And these are the ones that generally cause those varicose veins, leg swelling, and things like that. So the ultrasound is what diagnoses everything. After all that, once it's determined that you do have vein disease, then the first line treatment is going to be socks, the compression socks. And it's going to, unfortunately, they're quite tight. It's a medical grade compression, but you can try those. And a lot of it is also increasing activity, doing leg exercises throughout the day. And if you're a little bit heavier, then sometimes losing a bit of weight may help. If none of these work, then we go on to try more interventional aspects.
So when you talk about these, I guess, non-invasive treatments, Well, first of all, where do you tell patients to get compression socks? Do you always go through the medical supply, or do you have them go to Amazon to get a medical grade?
Yeah, so they can go to a medical supply store, but the company that I work with, Center for Vein Restoration, we actually do provide a website where you can go and buy them online. Perfect. So I measure everybody to fit the stockings. This isn't something that's easily like, oh, I need a small, medium, or large. You have to measure how big your ankle, calf, and your thighs are. And then based on that, and then based on the particular stocking that you want and the amount of tightness that's recommended to you, the sizing will differ. And so we provide all that information. And so then they can take that information and either go to our medical grade stocking website, or they can go to the medical supply store and get it.
You know, everyone asks you this question. But doctor, how do I get these darn things on? You know, do you have any good, I know my tip, I'll tell you mine after you tell me your tip.
Well, I personally get mine on by laying on the floor and just pulling.
But if you can't do that, like a lot of
no, you can't do that. And especially if you have problems with your wrists, it's not ideal. There's a number of different devices out there that can help put them on. There's things that just help put it on over the heel, and then there's actually like big contraptions that actually you put your sock on it and then you just pull it up.
Yeah, that's the one I like. It's called I never heard of it. A patient told me it's called a Dolphin Donner.
Yes, yes.
And it's basically like this fake sock that goes over the top. It rolls up and just goes right on.
Yeah,
it's a little expensive, but if you're doing it every day, it just works great.
And it's one of those things that the Dolphin Donner especially is a little hilarious to have, because it's the way that it looks. Now everybody will have to go and look it up.
Google it. So once they try this, let's say 6 or 8 weeks you try this, or what's the amount of time you have them come back?
Usually people have tried some sort of compression before, especially primary care doctors are really good at doing this, especially in this area. But I like to do a long-term compression trial, up to 3 months.
Okay.
And the other thing is, with a lot of insurance companies, if you do decide to do some sort of intervention, they do require the stocking trial as well.
One of those boxes you have to check off.
Yeah. But you know, a good faith effort, there's some people who after doing that are like, I'm so much better, this is the way I'm going to go. So
yeah,
I don't know.
It's worth it. And then in terms of now this is always another question. The way I understand it, compression is only covered if you have an ulcer. So how about these patients that don't have ulcers? Can you get it covered, or pretty much it's just out of pocket?
It depends on the type of insurance that you have. Okay. So if you go, a lot of places we can run the insurance to see if it's covered. Sometimes like one pair is, but the others aren't. Our website actually sells them for a discount, so that's a little incentive for us. But my office, if you're really in dire straits, if you really can't afford them, we can help them out as well.
It's the right thing to do, I think, to try. So they get past that, they've tried that, and they're aware they're probably going to use them the rest of their lives. But then when you go into the interventions, let's talk a little bit about, is it procedures that you guys do? Is it, so let's talk a little bit about some of those procedures.
Yep. So depending on where the problem is, so we'll get that information with the ultrasound. But everything that we do is done in the office. They walk in, they walk out, they don't go to sleep. If you need anything, it's done with local anesthetic. The longest procedure takes about an hour. The shortest procedure may take about 15 minutes. And there's a variety of things we can do. The goal is to shut down that vein that's a problem. These veins aren't helping you. All the blood is trying to go the opposite direction of where you want it to, so they're just causing a problem. So what we do is we shut it down so your blood can be redirected to your healthy veins and your circulation overall improves. And the way we shut it down is either with heat, with laser. You know, people commonly talk about laser. There's something else called radiofrequency ablation. You can shut it down with a chemical. So you can just inject something into it, and you can shut it down by gluing it. That's a fairly new technology where you just glue the vein closed. You can take them out by a process called phlebectomies, and or you can just you can just inject the veins.
And then, and that's really patient specific of which one's going to work best for them and their specific needs. And so, and I think initially you addressed this, I just want to address this again. I think people's impression up to this point has been, well, it's just a varicose vein, insurance isn't going to cover it. And like, it's considered a cosmetic procedure. And from what I was surprised when I was talking to you, you said that a lot of times these are covered by insurance because they're causing pain and there's a deeper issue going on. That's the real magic, I think, in what you do, is determining what's the deeper issue going on, right?
Yeah, because it's, a lot of people come in initially because of the appearance of it, but once you start thinking about it and once you start really talking to the patients, there is leg pain, there is tiredness, there is swelling. And if you really look at them, sometimes there's early skin changes where they can have a little bit of bruising going on. But this can usually be covered by insurance. That is correct. Most of the major insurance companies will cover it. Not necessarily some of like the little spider veins and that are purely cosmetic. But yes, most of it is covered by insurance.
Yeah. And what's something is interesting, I never thought of this before, I'm just kind of thinking of it now. I think up to this point for me, and probably you even as a vascular surgeon, you were only treating with these ankle sores on the inside of the ankle only when they became sores. You weren't doing a lot of just the color changes on the skin prior, right? You just wait till it gets really bad and then you deal with it. Now you're able to prevent things from happening. Is that what I understand?
Yeah, so it is once you recognize it, you can prevent that from happening, because venous disease is progressive, and not everyone will necessarily go from just having large varicose veins to getting an ulcer, but a small percentage of people do. And the goal, especially if you have a huge family history of bad legs, is to prevent that from happening. Because once you hit that stage where the skin starts changing color, then and your swelling gets a little bit more, that's not really, what's the word?
That's fine. This is the fun part about doing it.
You can't really go back.
Yeah, you can't go back. It's permanent. Okay. Wow. Yeah. So I think for people that are listening here, for those that are listening, like if you have swelling, if you have like dark discoloration around your ankles, which is so I half of my patients I see on my Fridays, I see on my diabetics. That's like half my diabetic day. It might be something to consider looking. If people want to learn more, Dr. Kim, about you and kind of what you do, was there a good website or place they can go?
Yeah, they can go to our website. It's centerforvein.com. And once you put in the location, you can get specific to my page and learn a little bit more about me and what I like to do, and our offices. I have two offices, one in Framingham and one in Woburn. And if they're just questioning whether they may have something, we offer something of like a short free visit. Complimentary visit. It's about 15 minutes long. They come in, I look at the legs, you can ask me any questions, and it's just a nice chance for people to meet me and to see what they might need. And if I determine at that visit, we should really go ahead and get this ultrasound because it looks like you have something, we can get that scheduled. Or if it seems more to be a cosmetic thing, then we can talk about those options as well.
Yeah, I think that's the way medicine is going more and more now, is because a lot of times patients, I find they tend to Google things too much. and it's nice just to talk to someone just for 10 or 15 minutes. And I think the future might even be like a Zoom thing like this. They can, hey doc, here's some pictures, take a quick look. Okay, I don't think you're a good fit, or I think you're a good fit. So many people have that uncertainty whether or not they're a good fit for this. And I think just talking to someone, and I'm the same way, if someone has a question, they can just kind of come in, ask it. And for a lot of people, no, they don't need to see us. But for a lot of people, oh, I didn't know. So
yeah, and even as you said with the Zoom thing, if we're still in COVID, so if people are a little wary of venturing out, or if they just want to do something while they're at work, we do have that virtual option as well.
Good. Yeah. Well, thank you so much, Dr. Kim. This was very informative.
Thank you for having me.